Rend College's Associate in Applied Science degree in nursing will prepare you for a career as a registered nurse.
Our goal is when we have a student graduate from our program to be able to enter the nursing field as a novice nurse at a safe practice level. So we want to make sure that they can take the data that they're gaining through their assessment skills and be able to plan and implement care for those patients in the hospital setting.
This is a Kelly Sim doll, and it's a mannequin, one of the newer advanced technology mannequins we use here in our department to help students hone in on the things they need to know when they get out in the real world.
We followed Dr. Joyce Duncan's dynamic model of integration where we talk about mind, body, and spirit. So we like to start in the classroom with that basic knowledge of this is what you're going to do and why you're going to do it, and then we take it to our lab component, which is what you see behind me. We like to use our practice skills on our mannequins where we practice giving injections, giving baths, passing nasogastric tubes, performing CPR, just the multitude of different tasks that nurses need to have.
You have to really look at the patient, you have to look at the whole situation and what you're treating. So it has to do a lot with prioritizing, delegating, critical thinking, putting the whole picture together as a nurse, and then what's important, how fast you react. A lot of hard skills that a lot of combinations.
If you haven't read the papers lately, then you're not aware of the nursing shortage, but for the next 20-30 years there's a severe nursing shortage, and we are trying to fill that role here in Southern Illinois.
There's just a multitude and such a variety of nursing that I think that's what keeps your interest over the years, is that if you like trauma, you do ER and critical care. If you like babies, then you go into neonatal. You start with an ADN, you graduate to hopefully go to get your bachelor's, hopefully then even to get your master's, which was required of me to get my family nurse practitioner. So depending on what level you want to stop at, you can stop. If you want to continue, even getting your doctorate, it's just a multitude of areas to which to go in.
With an associate degree in nursing, you're virtually limitless because you can start anywhere in the hospital and work your way up through the ranks. A lot of the facilities in our area will like you to start in a med-surg area, and then once you develop those nursing skills, they'll allow you to go to surgery or OB or ICU or critical care. There's dialysis, school nursing, home health. There are no limits to what you can do with your nursing degree.
The classes you want to focus on to enter nursing, any kind of a nursing program, would be things like math classes, science classes, and English.
We think a student should take all the science courses they can and psychology courses as well. The science courses will help them make that transition into our program easier because they'll be able to synthesize the data that we're giving them here. And then also the psychology courses will help them pull in that human aspect to our science courses. With your associate degree, I would say about $25+ an hour. A lot of areas are using agency nurses now, and because of the use of agency nurses, they usually pay a little bit higher, but anywhere from $16 to $25 an hour, and that's including excellent benefit packages at most places. It's a great opportunity, and I would fully recommend it to people who are just getting started in the workforce to really think about nursing as a career, because not only is it a job that you go to every week, but it's a career that you learn to love.
Additional information about Tech Prep and the Associate of Applied Science degree in nursing can be found on our website.